Welcome to the Honest Mamas podcast, where we talk about the emotional and spiritual aspects of the motherhood journey. We are a team of honest mamas. Myself, Melissa, Sophie, and Claire. We are psychotherapists, moms, and friends. Join us as we get real about the topics that matter to you. Hi, mamas, and welcome to episode 30 of the Honest Mamas podcast. This is Melissa, and today I have the pleasure of chatting with Tami Hindin. She is a baby whisperer. That's what I call her anyway. And she practices craniosacral, Chinese medicine, movement for babies, and also acupuncture. So let's dive in with Tammy and my conversation about how to support new babies and mamas on this journey. Welcome to my conversation with Tami Hindin from InspireMindBodySpirit.com. Tammy, thank you so much for coming on our show today.
Thanks for having me.
Absolutely. I've been so looking forward to this conversation, and I still remember the moment I went 5 doors down from where I was living to your office in a huge ball of anxiety with a very loud crying child. Looking for support. I had heard you were the baby whisperer, and I thought, I need to see this woman. And you helped a tremendous amount. And so I'm so excited for today's conversation years later, where I feel a little bit more adept at parenting and, getting to learn my child. And I just think today what we're going to talk about will help a lot of women in the early days.
Absolutely. Thanks. It's great that you had that experience.
Yes. And I've heard it's not just me, I've heard so many other women who just rave about you. So I'm glad that we're having this chat. So why don't we dive right on in, because you work in a few different modalities with new babies and with mamas. And I thought we could start out with craniosacral. I know that you work, you're an acupuncturist, you're a craniosacral therapist, you do so many different things. And I thought we could just kind of dive into what is craniosacral and how do you use it with babies?
Sure. Well, it's definitely the $1 million question for sure. And it's not something that's easily defined. So I can absolutely try and define it the best I can. But I guess I want to just say, because you mentioned I do many things, that what I do is several things kind of mishmashed together. So it's not just that I'm doing craniosacral therapy, it's all the things I've taken into my toolbox to work with my babies. But basically, it is a light touch therapy.
Okay.
That we talk about it as 5 grams of pressure. So that's the weight of a penny. It's super light touch, and we're not doing any sort of forceful manipulation or adjusting. It's literally we're putting our hands on the body with this light touch, and we're tuning into the body. And the reason they call it craniosacral therapy is because we're accessing the cranial bones and the sacrum, and actually all the vertebrae in between. So the system from the head to the tail, to access the craniosacral system. And everybody's like, well, what is that?
I was going to ask.
So basically, you have your spine and your brain, and that is surrounded by fluids, which is your cerebral spinal fluid. And then that is encased in a membrane system, and there's 3 layers to that membrane system. And like I said, if we can use the bones to access that system, we can then do the therapy. And the reason it's difficult to define it is any skilled craniosacral therapist is going way beyond that system. We're working in every part of the body. It's not just there.
Got it. And so how do you use this kind of technique along with, I loved when you say you have sort of a couple different tools in your tool belt. I actually love practitioners like that. I have a deep respect for practitioners that are like, this is all I do. I'm an expert at this. This is all I do. And I really, because I work very much this way, that there's almost like a holistic kind of bent to what you do, that you really see a baby or a mom. I'm imagining, I don't know, I'll ask you, as like a whole kind of person, as a spectrum.
Yeah. So I often say I'm working in high def.
Yes.
I use everything I've learned in all the different therapies, which include traditional Chinese medicine, craniosacral therapy, body-mind centering, and I've studied movement like Pilates, the gyrotonic expansion system, embodied yoga and anatomy. And the biggest lesson for me has been a mom and having my babies and working with moms and babies. I learn the most from my patients and from my kids.
Absolutely. Great. So then a new mom comes in. Explain to us sort of how you use craniosacral. And I know we'll kind of get into the more of the movement work a little bit later on about, just with the craniosacral piece, how do you use that with babies? What does that look like? Because I imagine a baby laying on their back, not very still. Like, how do you do it? I mean, I saw kind of how you did it with my son, but like generally speaking, how do you do it? How do you keep him still?
Yeah, I mean, it definitely takes a skill. That's why there's not many of us doing it. And it takes patience, and it also takes understanding.
Mm-hmm.
Every patient and every session is going to look different because I'm there with the baby in their moment as well as with the mom. Because sometimes the session's about the mom, even though we think it's about the baby.
Yes.
But essentially, if we can, the best way is to get the baby onto a massage table, and they're teeny tiny, so they're like this little baby on this huge massage table. And I get the mom to come and, do whatever they need to do so they feel comfortable. Some moms just like to sit in the corner and try and fall asleep, but,
I think that might have been me. Oh, you got this, Tammy. I'm just going to hang out back here. You got this.
Exactly. But, some moms want to be there and touching, and that's great too, because sometimes that's what's needed as part of the treatment.
Mm.
Sometimes some babies are just breastfeeding the whole time, and they're sitting breastfeeding their baby, and I've got my hands wherever I can. I mean, I'm like an octopus. I try and get wherever I need to be. There's other times where babies don't want to be sitting down. They don't want to be nursed. We all know that scenario.
Yes.
And I'm like walking around, hushing them and doing my therapy that way. So, it's like I'm there to do whatever needs to happen to make the session happen.
And what do you notice? Like once you start with the light touch, the hands on, I mean, number one, we should just say for the listeners that don't know, you're an extremely calm person. So automatically walking into that space as a mom and as a baby, I would imagine there's already kind of a lowering of energy, which is really beautiful and calming.
Absolutely.
And yeah. And so as you're doing this work, what do you notice and what are the kind of therapeutic benefits for a baby? And also, this question is just coming to me now. We've talked a little bit because I had 2 C-sections and came with my baby in that way. Do you notice a difference between C-section babies and vaginal birth babies?
Absolutely. Basically, I feel like I speak the baby language. I don't know what it is. It's just a connection I have with the baby. I'm there with them. I'm really in their moment. So I can really feel if their system is jazzed up, if their system is feeling like nothing's there, the lights are out, and my goal is to kind of help them find what it is. And I'm not ever making something happen. I'm saying, hey, I'm here to support you. What needs to happen? And then the baby's body will guide me to all the different places on their body. And, sometimes I'm just at their tail. Sometimes I'm at their head. Sometimes I'm in their mouth. It's so dependent on the baby and, whatever trauma they've gone through, because the birth process is a trauma. Mm-hmm. No matter how beautiful it is, they have to come out of a teeny hole.
Yes.
Or they have to be ripped out, in a C-section kind of way. Right. Or, there's other ways that they can come out that are pretty aggressive as well.
Right. So right.
I'm there to listen to their story.
Mm. And I imagine it's a heavy dose of intuition, kind of you've been doing this for a while. And so yes, kind of leaning on the craniosacral principles and hand placements, but a lot I think is also, and you tell me if I'm wrong, it's just kind of getting quiet. And I love when you say you meet the baby in their moment. Mm-hmm. Because as you know, as a mom, as I know as a mom, as many of our listeners know, when your baby's crying and completely throwing a fit, the last thing you want to do is meet them in that moment. You want them to just be quiet, and peaceful and happy and just relaxed.
Yes.
So do you use a lot of your intuition and kind of your gut feeling to sort of go to the places that need to be gone to with your patient?
I do. I mean, I always talk about acupuncture and craniosacral therapy being like the doorway for me. And then it's kind of like, my embodiment of my spirit and my connection to my intuition. that then guides me deeper and allows me to, because babies they don't communicate through words, right? So they communicate through energy. And I have to meet that energy. I have to be present to that. And the only way to do that is to be connected into myself.
Absolutely. And you mentioned acupuncture. I know, because I've been to you a couple times for that too. I know, when do you start working on babies with needles?
It can happen right away. I mean,
really?
My kids, yeah.
Wow. Okay.
Yeah. And then, it's like people are like, what? But
wait, you're going to stick a needle in my little week-old baby? Are you crazy?
Exactly. The needles are the smallest needles that we have. And when we needle a baby and a child, the needling is in and out and we're done. It's not like I'm poking them and then okay, baby, sit for 20 minutes.
Gotcha.
And a lot of times it might just do acupressure, and that is just as powerful as a needle.
Absolutely. Absolutely. So with the craniosacral and with the acupuncture, and we haven't gotten to the movement quite yet, but with these two kind of modalities, and when, a baby comes in to have a treatment with you, you kind of, what I'm hearing you say is you follow where they're at in their moment, you kind of sense into what they may need, and then you're taking into account, obviously the mom is coming to see you for a reason, whether it's a tongue tie or, reflux or breastfeeding issues, or I don't know. Who do you kind of see, I guess? Why do people come in for craniosacral and acupuncture with a baby?
I mean, anything is fair game, but
okay.
What I see is a lot of breastfeeding difficulties, and that could be coordinating their suck and swallow. They fall asleep, they're not thriving, there might be pain for the mom. But then there's the whole digestive issue, constant gas, colic, acid reflux, constipation. I see babies with asymmetries like torticollis or the flathead, which is plagiocephaly. I see a lot of babies, like you said, with the tongue and the lip tie. They'll come either before or after the procedure, depending kind of when they find out who I am and what I do. Sleep issues, developmental delays. And when I say developmental delays, I'm not talking about when we think of serious developmental delays. I'm talking about if a baby's not rolling and it's around the time that they should be moving and they're just still laying on their back, or that they hate tummy time. There's a reason they don't like tummy time. Or if they're like that baby that's just in super high tone and super straight all the time, and their mom's so proud because their neck is up day one. There's a reason the baby is so revved up to go.
Yes.
And so there's so many things that people can come in for, but those are just kind of a little tidbit of what could be why people come.
Because I'm thinking now, people that are in the New York area, amazing, you're a resource here. But for people that are listening that are outside, the area, the states, maybe even different countries, just being able to kind of gently explore, someone that may never have thought about these holistic modalities, whether it's acupuncture or craniosacral, and then we'll get to the movement in just a moment. But I think it's a really good reminder that there are other holistic modalities to help ease some of these, challenges that come up with having a new baby. That could be actually very effective, if not it's sometimes more effective.
Absolutely. And I often say to people, you don't need a reason to come. Like I said, the process of birth is really, the process of becoming a being is huge. And then coming out and all the mom and the dad and everything coming, that's a lot of stuff coming together. And the more we can clear that, the better we're setting ourselves up for a really good life.
I just even imagine babies coming out and the harsh lights and the sounds that aren't muffled anymore. I mean, it must be a complete shock. No wonder they cry, when they come out. So, okay, let's talk about the movement work that you do. You explained it to me as Infant Developmental Movement Education. What in the world is that, Tammy?
So basically, I educate moms on infant developmental movement, which is not just them moving, but it includes how they start developing in utero, and when they come out, all the things that happened in utero, the little movements, kind of coming into their, they're like a fish that come in and out, that's flexion and extension, but in a different kind of way. So there's so many things that are happening in utero that then have to start developing with a different sense of space and gravity.
Yes.
And, what I tell people is it doesn't just happen. It's amazing that in the first year they become walking and talking beings, because there's so much, if you really break down the senses and the reflexes and all the things that need to happen for it to happen, it's pretty amazing that we get there.
Yes.
And to be honest, there's more and more babies that aren't getting there.
Really?
Yeah.
Wow. And so what does this look like? Like if I were to come to a class or a group or a session with this type of movement education, like what could I expect if I were to bring my little one? And what are the ages, I guess, that it starts from, right from birth?
So I mix my movement education in my private sessions, but then I also do like a baby lab session where and it's literally like a lab. So, it's a really open circle that I've created for moms. It's a resource for them to learn where their baby's at and what's happening, and also to get them in their bodies, because if you're not present in your body, you're surely going to miss when your baby's in their body.
Mm-hmm.
So we're on the floor, we have mats, we're in a circle. There's like there's a baby mat in the center, and we kind of put the babies in the middle. And we kind of go around. It's kind of a little bit like a therapy session. I mean, you get enough moms together, and we're always kind of supporting each other, right?
Yes, I'm sure there are tears.
Yes, tears and letting go. I do a lot of ritual where we just kind of try and let go of stuff, and in a ritualistic kind of way. So
Awesome.
It really feels like we're letting go. I get the moms in their bodies first. We do some meditation and some infant movement in their own bodies, so they can really feel what it's like to actually move.
That's
without
beautiful.
Any sense of what it is to have a body in this.
Beautiful.
Yeah. And then we can look at the babies and be like, okay, like this is where they're at. Don't compare them to that baby next door or this baby, but where is your baby? And, everybody progresses on their own line. So we have to kind of take that into account. If your baby's not rolling, maybe that's because they just started moving to their side or moving to their tummy. So you have to take into account so many little pieces that I feel like I can provide this lens for moms to just kind of be present. And then I show them ways that they can support. And it's simple stuff. It's just like sometimes it's literally laying right next to your baby when they're on their side so they feel safe, that they're not going to fall on their back or their tummy. There's a simple move I teach my babies called my mom's, not the babies, but it's called the baby ball. And, you can do it in different positions, but if you have your baby, you're holding your baby in your arms, you can put them to your side and literally take their arms and their legs and bring them into a ball. And this kind of sets them into that in utero position so they can reset and regroup, because babies don't know how to relax. I mean,
right.
Most people don't know how to relax. So
yes.
This is a way that we can kind of start teaching our kids from a really early place to start to be like, okay, I can shut down, regroup, and like, let me take a look at something now.
I still need that. I still need like a shutdown power, 10, 20 minutes of like silence, dark, white noise, preferably. It's probably very much like a womb.
It's exact. And I do that with my moms. I mean, it's amazing the simple little things I do with my moms. And these are things that, like you had asked me, that they can actually take home and do. I mean, obviously doing is a whole nother thing, but like I'm giving them resources that they can then do. And when you're doing them on the floor for yourself, your baby's right there with you. So it's not like, it's a whole process of being together and getting in the groove.
Well, which brings me to, a lot of moms that I work with in the therapy world and colleagues and friends, there's a lot of anxiety giving birth, generally speaking, to the first baby. You don't know what the heck's going on. You don't know what to expect. Maybe the birth experience was not as you had imagined or hoped for. And I'm imagining you see a lot of moms in perhaps a space of anxiety. And so when you talk about the movement education, I'm curious, like when you give some of the moms some of the homework to take home, can you share with us maybe just one very simple thing, maybe a mom who's listening who can't come and see you directly or come to your group, what they may be able to do to kind of bring some more calm and some more ground?
Sure. I mean, I always say get on the floor and be with your baby, because if you're really watching at like the fact that your baby can like turn its head or move its hands to its mouth, like really watching like how amazing that movement is. Like it didn't just happen. Like there was lots of things that had to fire to create that movement. So getting on the floor is number one. Being there with your baby, because you can do this, like I said, with your baby present. Of course, there are moments when they're freaking out and crying, and that's probably not the best moment to be doing it.
Right.
But one simple movement is actually based on a reflex called the tonic labyrinth reflex. And this is literally the reflex. One of the first reflexes of gravity a baby experiences when someone pulls the baby out and they're being supported by a hand.
Mm-hmm.
Their body part that's connected to the hand is experiencing tone for the first time.
Wow.
Tone and gravity, right? So I teach my parents an experience to kind of get into their bodies and into their tone. And what you basically do is you lay on the floor and you start on your back. I mean, some moms need lots of things to kind of relax. So put on good music, burn whatever you need to burn, or, put anything you need to put on to get yourself in the mode. Mm-hmm. And then lay on your back and be there for a few minutes. Really feel your body connecting to that surface. And then when you're ready, you turn to your side. Pick a side and turn to your side and do the same thing on that side. And then when you're ready, roll to the other side and do the same thing on the other side. And then again, when you're finally ready, you roll onto your tummy. So now you've activated all your parts of your body, all the sides of you. So you're almost embodying your whole body. And it's amazing it could happen in a minute, or it can happen in 5, or you can take as long as you want. But it's something that is, every parent tells me it's great. It just allows them to get in. I use it all the time with myself. I mean, it's wonderful.
That is wonderful. I just had images of me rolling around my floor in my office. I have a pretty small office. I don't know if I'd be able to do it fully. But the other thing it reminded me of, which I think you said was so interesting to me, was the first point of contact that a baby has is, somebody, a doctor probably, or a doula, or a father or a partner, kind of holding and cradling the head. That's sort of like what we know to do. If you don't know anything else, hold the head.
Right.
And I remember, I don't know if you're familiar with Watsu massage, where, you're in a pool of water and you have your massage therapist there. And this happened out in California. And this person was holding my head and you're in this beautiful warm water. And I felt for the first time like, oh my God, I'm like in the womb. This is like really powerful. And so when you talk about those kind of points and feeling your body on the ground, it really, it makes a lot of sense to me. And I can feel it, in my body, and also so grounding.
Mm-hmm. Absolutely.
Yeah. So women that are wanting to connect, I know you work so much. I mean, everything you've said so far is sort of, yes, helping the baby, but also making room and space for lining up the mom and the baby together so that they can connect.
Yes.
And I'm curious about, what you might say to a mom who's listening, who really wants to connect more deeply with her baby outside of the womb. And maybe you could share both ways, like what to do to connect inside the womb if you haven't given birth yet, and then what maybe to connect with outside of the womb once your child is here and you're in triage.
Right. Well, I mean, I always tell moms getting treated during pregnancy is wonderful. And I realize it's not a resource for everybody, but if you can, getting treated with with someone who is informed on pregnancy and craniosacral therapy, one of our goals is to connect the mom and the baby, to at a point where, sure, we feel our babies, but it's a deeper connection that we can create, which really helps through the labor and delivery process. But, and the same goes for postpartum. I always I don't know one mom, and if you know different, you can tell me. I don't know one mom who is not in fight or flight after they have a baby. I mean, we are in fight or flight mode.
I'm in both. I was in both at the same time. I don't even know if that's possible neurologically, but I was fighting and I was wanting to get the heck out of there. It was crazy. Yeah. It's a crazy, crazy time.
Exactly. So, getting one treatment for yourself is just honoring yourself to actually be more present for your baby. So, I mean, that's one thing. And like I said, I know it's not a resource for everybody, but my main emphasis in my practice, which is from seeing so many moms and babies and their complicated dyad, which, no matter how beautiful it is, it's still completely complicated, is to trust your intuition and your instinct. And I just feel like there's so many moms, and I know you guys kind of address this in the Honest Mamas, but there's just so many moms who are disconnected from this connection inward to really being connected into the instinct that we have.
Yes.
It's just not there because there's so many things. That's a whole nother interview, but just really connecting in so that you can understand your intuition and your instinct and not have to juggle what everybody else is telling you.
Yes.
And ways that you can do that is getting into your body. And I don't mean like going and doing a crazy workout. It's more like, find a mindful practice or a class that will get you there. I do that in my baby lab. Like I said, it's really important. If I'm going to work with the babies, you need to be in that mode as well. I do a series where we actually go like a 4-week series with my moms where I teach them to nourish themselves so they can be present for their babies.
Wow.
And if you can find that intuition and that instinct, there's going to be so much more ease. It just blocks out all that chatter in your head and you can just be really present with your baby.
And I say, I'm just going to jump in here because I say so, or I have said so many times on the different podcasts that I've recorded and the many people that I've talked to, is that I really hope as a culture, as a society, as we're moving forward, that we really start to honor the woman's intuition and the woman's kind of going inward and fostering that process. Because to me, that is so important. And, we focus so much on what hospital, what doctor, what doula, what accessory, what, car seat, what outfit, whatever, and some of those are absolutely necessary. I mean, they all are absolutely necessary, but there's such little attention paid to, okay, mom to be, like, have you gotten quiet with yourself? Have you, yes, I think self-care is definitely more kind of in the norm to talk about now for a mom, like, oh, don't stress yourself too much, eat these sort of foods, that kind of stuff. But I think what you're talking about and what we try to help women do is sort of to feel into and to think about this process in a little bit of a deeper way.
Absolutely. But in order to get there, you need to nurture yourself. And when we come out and we're in fight or flight mode, we'll be there for the rest of our lives if someone doesn't take us out of there.
Yes.
So, this idea of this tribes had groups of women together to support each other, which we don't have. So, I mean, it's so important. We get that support from whoever we can, friends, family. Let them cook you meal. We're so stubborn as moms. Like, we don't want anyone to help. I mean, I'm always like, let me take your baby when, like the car seat when we go from my waiting room into the room. And I can't tell you how many moms will say no. And I'm like, no, I'm going to do this for you because you got to learn to let someone help you.
It's not that far.
It's not. So, it's like, in order to stop that fight or flight process, if you can't get a treatment, you have to start understanding you need to nurture yourself or else it's not, take a hot bath, like get someone to watch it. Your baby is going to be okay for 5 minutes if you can kind of just let yourself do something for yourself.
Yes.
It's so important.
Yes. And so after the baby comes out of the womb, I definitely hear, whether it's craniosacral or acupuncture or some of the movement education, and even things to connect more deeply with your baby. Even a music class, I think, is like a beautiful, maybe, a way to connect. But if someone is wanting kind of an idea, to bring home, what is one way, that you might suggest a woman can connect with her baby once the baby's born at home?
So a simple way, again, is doing that exercise I told you about, laying on your back, getting your baby in that baby ball. It sounds like, how can that help? But honestly, it's like the 2 major things I tell my parents to do. And they always come back and they're like, wow, that really helps. And there's that series I was telling you about where I do a 4-week series. And one of the first classes we lay down and we do this meditation where I bring them into almost the process of in utero. And there is this moment when I have these moms, and there was one time where there was a dad, and they're all laying super still and quiet because I got them into this meditative place. And the babies were super quiet. I mean, it was every time I do that exercise, it happens all the time. I'm like almost in tears because it's amazing to see them just vibe off of each other because the baby is going to vibe off of your energy. And it doesn't mean like, just because like you said something bad, your baby's like now taken like this horrible thing, but it's just this constant like energy of stress and anxiety that they don't need to pick up.
Yeah. And I think lastly, what I'll say before we end is that, you know, as a new mom, like the last thing you need to feel is any more guilt. I think it just comes inherently when you have a baby. Yeah. So, you know, I just want to say, and I know you're saying this and you sort of say this in your own way, but is that to give yourself permission that if you're, and of course, coming from my mouth, I'm a therapist, for goodness sakes, that, you know, if you're feeling anxious or you're feeling depressed or you're feeling angry or frustrated or whatever, you know, it's okay. Like, yes, I too believe that absolutely babies pick up energy, but I don't want moms to use it as another way or another thing to beat themselves up with.
Absolutely.
So, you know, to me, it's just an indicator of like, okay, I'm noticing that I'm completely anxious, which was my experience. And, you know, what can I do? How can I take responsibility for my anxiety and really try to learn ways to calm myself down so that when I am having interactions with my child, at least I've tried to do some work, somewhat effectively at the time, you know, to really kind of bring my energy down and ground it before in interaction with my baby.
I totally agree. I mean, that's just to say, I tell my parents all the time, because they ask like, oh, I was so negative in the first few weeks, like I've totally messed up my baby. And it's not like that at all.
Right. Well, thank you, Tammy, so much for being here. I so appreciate you taking the time to chat with me and to really give some really good information to moms out there who maybe didn't even know this was possible, you know? So thank you so much.
Thank you for having me.
Thanks so much for joining my conversation with Tami Hindin today. I learned so much in this conversation with her. And what I love about this chat was that she gave such practical tools that if you're a new mom or even if you're a seasoned mom, you can really take them home to connect not only to yourself, but also to your baby and to your child. And to get in touch with Tammy to learn more about her, you can go to her website, which is www.inspiremindbodyspirit.com. And inspired is INSPIRE. And if you want to get our show notes and more information, you can go to www.honestmamas.com/episode 30 and also join our community on Facebook. You can go to www.facebook.com/honestmamascommunity, where these conversations and way more will continue.